If the past year has taught us anything, it's that health knows no borders, right? As a public health community, we need the interdisciplinary approach and collaboration of global health in order to make strides toward a more healthy and equitable world. That's why our vision in the Sparkman Center for Global Health is to make substantive and sustainable contributions to the achievement of health equity and social justice in resource-limited settings around the globe by working collaboratively to increase public health knowledge and capacity. The Sparkman Center for Global Health, we celebrated our 40th anniversary in 2019, and we're really proud of our legacy as one of the oldest global health centers in the US. Today, I'll be highlighting our graduate certificate in global health, where you can invest in your global health education alongside your public health curriculum. But our programs in the Sparkman Center go beyond the classroom to cover global health education, research, and community engagement. So just a tad about me, my name's Katie Adams, and I'm the program manager for the Sparkman Center, which means that I am your go-to person for any of the programs that we offer here. I served in the Peace Corps in Nicaragua, which is where I started working in public health and then worked as a health educator in Birmingham. I've been at UAB since 2017. Yes, 2017. And I am an alum of the MPH program and the graduate certificate in global health. So I'm happy to talk about my personal experiences with those as well. All right, so the Graduate Certificate in Global Health is a transdisciplinary program for students seeking a set of skills for understanding contemporary health challenges and thinking about how they might best be solved to improve health and health equity worldwide. Leah Grace Simmons graduated from the program a year ago, along with her MPH in epidemiology. And she said that, coming from a multicultural background, she was interested in learning more about how culture and identity influences health. And so she felt like the certificate gave her more of an insight to the realities of working in global health. The certificate is open to all UAB graduate students, along with working professionals and selected undergraduate students. It can be completed alongside degree programs or as a standalone. And that's something that's really special about this program. In GHS classes, you're not just going to be with other public health students, you're with students from health administration, from medicine, from nursing and engineering and business. And you have a real diversity in how long people have been in their careers. And it brings something really special to the discussions in the classroom. Speaking of the classroom, the curriculum for the certificate, it's 15 credit hours total. There are 2 core classes, so that's 6 of the credit hours, and then the other 9 are electives. Core courses are offered in fall of spring, but on alternating academic years, which can get a little confusing, but I can explain it if you choose to join the program. And some of the skills that we focus on in the certificate are international program management, community development principles, health policy brief writing, program evaluation and monitoring. We're really focused on those direct, concrete skills that can be used in global health. This is the curriculum planning worksheet, which gives you an idea of when courses are offered, as well as what kind of electives we offer. The core classes do not have to be taken first, and the entire certificate can be completed online. As you'll see under other electives, we accept some electives from other departments as part of our certificate. And so that's one way that MPH students often lessen their course load of doing the MPH plus the certificate is, say, if you go into epidemiology, you can count one of the epi courses towards the certificate. You can often count one of our GHS classes, especially the infectious disease class, towards your MPH as well. So that's something that we coordinate with students directly with advising, and then the student, you work with your program coordinator for your department so that we make sure you're on track to graduate when you want to. So you may have noticed an elective on the last page called CFAT. It's not a study abroad program, but a study away program. So CFAT stands for the Southern Institute for Appropriate Technology. It's a field course in Lineville, Alabama, which is about an hour and a half east of Birmingham, going towards Atlanta. And students that attend get to learn about sustainable and community-based models of development with a particular focus on technology and innovations. The way the program works, it happens in the May semester. You have the first week of online modules, then 2 weeks where all students stay on site in Lineville. It's an immersive experience. And then 1 week of online modules to finish the May semester. And all of that, because it's such an intense class, it's worth 6 credit hours. And so that's one way to fast track your completion of the certificate because you get 6 of the 9 credit hours that you need for electives in this 1 month. We often invite international partners to come and train students on issues and technologies that they use in their home country and that have proven successful to help with water and sanitation, agriculture, housing security, just so many things. You can see in some of these pictures, they're lighting efficient cook stoves, they're in the garden, learning about gardening practices, using a solar oven, and making models of a water pump. All right. So you might be asking yourself, how can this certificate contribute towards my career? And that is the right question to ask. That's very important to consider if you're going to add extra classes. So Deandra Brown Tiyashimi is finishing her master's in community health this semester. She finished her certificate last semester. And for her, being in this certificate and taking especially the critical issues in global maternal and child health was really a turning point for her and her career, because talking to the professors in that class, she realized how there's a real need for African-American doulas and lactation consultants and the issues with maternal mortality that we have here. She became a doula, paused her education, went into the Peace Corps in Rwanda to be a maternal and child health volunteer, and then came back to now finish her education and continue working in that track. Another example is Erin Palomares. She graduated in 2016 from UAB. She did her MPH in Healthcare Organization and Policy. And she's currently Deputy Director of Global Handwashing Partnerships at FHI 360, which is a really big global health NGO that's based in DC. She was a recent panelist on a panel we had called Going Global. It was a discussion about getting started in a global health career with 3 recent UAB alumni. And that is now posted on our YouTube. I highly recommend you check it out. It was a really great discussion. And it was 3 alumni that have just had such different paths and are really working in global health. So outside of the classroom, I said we have other programs. So I'm just going to show some examples of other things we have going on in the Sparkman Center. Even if you don't decide to take global health classes, you can still get involved with global health. One is our Sparkman Fellows program, which is a mentorship program that matches students with a global health faculty member that they work with for a year. Fellows often engage in research or other projects with their scholar mentors, and it's open to upper level undergraduate, graduate, and professional students at UAB across disciplines. So it's another way to kind of meet and work with other people interested in global health, but that might be coming at it from a different perspective. We also have our yearly global health case competition, which is a really great way to get involved. And if you win, you also get some money. So how it works is that multidisciplinary teams of students are given a case topic on Monday, and by Saturday, they have to have an innovative proposal, a 15-minute pitch of how they would address that global health issue given, whatever monetary or time constraints we've given in that case. So some examples of past cases have been about deforestation in the Amazon rainforest in Peru and its effects on child health, feminine hygiene in Uganda. This year, the case focused on dengue prevention and management, with a special focus on vaccine hesitancy in Cambodia, Vietnam, and Indonesia. With as much as people are talking about vaccine hesitancy now, it was especially interesting to see how those conversations about vaccine hesitancy with COVID could also be applied to dengue. Like I said, you can win some money. The first place team gets $1,500, second place gets $1,000, and third place wins $500. So really hope that you join case competition if you come to UAB. And we also offer some opportunities that will get you out of your state, out of the country. We have summer internships with partner organizations that we work with on a regular basis. And when students travel for those internships, we're able to provide a stipend to cover some or most of the travel and accommodations. Some examples of internship placements have been, let's see, these were from last summer. So in Kenya, we had a student work with the Kenya Medical Research Institute on a project about couples testing for HIV, and she developed some assessment tools and surveys. Then with the Caribbean Vulnerable Communities Coalition in Jamaica, we've had many interns with them over the years, both in Jamaica and in the Dominican Republic. And they're really focused on human rights, especially for LGBTQ populations, sex workers, really vulnerable populations to HIV infection. That is their main focus. We're actually having a really awesome panel with them later this month. If you're interested, that's all about the issues and challenges for the LGBTQ community in the Caribbean when it comes to accessing healthcare. So you can check that out. And then in Uganda, the Sunrise Center, we've had people work on program materials for a program about male involvement in parenting, and also some training and assessment for their program about eliminating mother-to-child transmission of HIV. So these are internships where you can have it count towards your MPH if you do the associated paperwork and things. And if it falls well within your schedule, having done all the core and those requirements. Or we have students do them just because they want the experience. So we offer these in the summer. And some other scholarships too that we offer. One is the Moses Sincala Travel Scholarship, which is to fund either a global health internship or research opportunity. So if you wanted to do an internship with a different organization in a different semester, you could apply for the Moses Sincala for that. And then the School of Public Health Global Health Foreign Travel Award is for School of Public Health students only, and it is very open-ended. It's about supporting students to go to a conference in another country, or do an education abroad program, or travel, if they're working with a faculty member and want to do a site visit for a research project. It's very open-ended. We want as many students as possible to get out there on the ground learning and training. So I know that was a whirlwind of things that we offer in the Sparkman Center. There are many, many ways to connect with us. We have a monthly newsletter, only comes out once a month. So if you don't, we don't bombard your inbox. But also we're on all the social medias. We're most active on Instagram and Twitter. We're like somewhat active on Facebook. And if you email sparkmancenter@uab.edu, those emails go to me. If I can't answer it, I will direct you to the person that can answer your question. So I hope that you get involved with us.